Welcome to another session of Voices in Health. I'm your host, Thomas Mehigan. Today we'll be discussing consequences of the overuse of antibiotics. Antibiotics are part of a group of drugs known as antimicrobial agents. These agents, penicillin for example, are capable of destroying or weakening certain microorganisms, especially bacteria or fungi that cause infections and infectious diseases. Antibiotics have been hailed as wonder drugs that not only can fight back lethal infections, they can save lives. But the Center for Disease Control now estimates 20 to 50% of all antibiotics prescribed are either unnecessary or inappropriate. In days gone by, the antibiotic penicillin was the gold standard in the treatment of many bacterial infections in many people. Now, many types of bacteria have developed resistance following extensive use. The overuse of antibiotics has resulted in new microbes that resist the effects of antibiotics themselves, and this can put patients in danger of side effects and even of introducing antibiotic-resistant bacteria into the community. Washington Hospital has implemented many measures to ensure safe and responsible use of antibiotics with excellent results. Outside of the hospital environment, however, there are a few things people at home can do to help curb the misuse of antibiotic medicines. With me are Dr. Dianne Martin, head of the Antimicrobial Stewardship Committee, Dr. Jevon Tang, infectious disease specialist, and Lina Huang, co-chair of the committee. Dr. Martin, can we go through some simple steps of what can you do to help the Washington Hospital team take better care of our patients?
Well, it's just like what your mom used to tell you, wash your hands, because we think that going into the hospital or seeing patients, if you're a visitor or a family member or physicians going in to see patients, if we're washing our hands, we're preventing any carriage of infection into the patient, and on the way out, then we're preventing any carriage of infection from that patient outwards by washing our hands both going in and coming out.
But also at home too, when you do care for a sick child, you do want to wash your hand often so that you don't transmit the disease to your other child or even to yourself.
Yeah, that's another question. You get a bottle full of antibiotics. You feel better in 3 or 4 days. So why should you continue taking the antibiotics even though you're all better?
When you're starting taking the antibiotic, the first organism that got killed is the sensitive organism, not the resistant one. So if you do not complete your entire course, you actually allowing a big chunk of organism to basically survive and start sharing how to resist the antibiotics next time. So it's very important to complete the course.
So if I don't finish all the stuff, there may be some bugs lingering in there that can come back and I get sick again.
Exactly, and then you have to retreat it with another course of antibiotic, which in turn is a longer antibiotic course. You may be given a different kind of antibiotic that generate your different kind of resistance. So that's
so the pharmacist and the infectious disease people know that to kill a certain bug, it takes a certain dose of a certain antibiotic, but for a certain period of time as well.
Yes, and don't pressure your doctor for antibiotics.
Yeah,
because
that's the one.
Many common illnesses like cold, or even some eye infection or ear infection, are not necessarily caused by bacteria. They could be caused by viruses, and antibiotics do not work on viruses. So I think it's important that everybody practice stewardship.
Anything for me to check? Oh, perfect.
It's our hope that the information you've been given by our guest experts will help all of us better understand antibiotics, their value, their virtues, their dangers. And you can see, working together, we can slow the spread of superbugs in our community. Thank you for watching. We'll see you next time on Voices in Health. To learn more about antibiotics, visit the Centers for Disease Control and Prevention site, www.cdc.gov. Thanks very much.